This is the shoulder exam, and with any exam you begin first with inspection. And inspection for the shoulder exam is really comparing one shoulder to another. Typically, one patient's shoulder is a little bit lower on one side than the other, going along with somebody being right-handed versus left-handed. The shoulder of the dominant arm is usually slightly lower. I'm going to look here at clavicles on both sides up to the shoulder joints and down to the forearms for comparison. Then I'll begin palpation, starting first centrally at the sternum. There's the sternoclavicular joint here, and I always want to compare one side to another, so I'll palpate one and then palpate the other. Follow along here, along the clavicle, and then out to the acromioclavicular joint, which sits right about at the end of the clavicle here, checking and comparing again to the other side. There is also a subacromial space that lies just underneath the acromion here that I'm going to be palpating and checking for any tenderness, comparing again one side to the other here. The last place to palpate is the biceps groove and tendon. You can palpate that just on the anterior portion of the head of the humerus, and you can sometimes move the patient's arm back and forth a little bit in order to feel the biceps. And then again, I'll compare that one side to the other. Then the next technique is range of motion. And Nick, can you turn this way for me, please? I'm asking Nick to turn for purposes of videotaping here so that you can best see the range of motion. So first I'll check flexion. And for flexion, ask the patient to have his thumbs up. So Nick, if you can have your thumbs up, and then bring your arms up over your head as far as you can. And you can compare one side to the other to see that he can lift both arms equally. And it's often easy to have a patient imitate what you're doing. Then bring your arms all the way back and as far back as you can. And again, you can see the extent of extension on both left and right arm, and it should be about equal on both sides. All right, now you can bring your arms to the side here. Now bring your arms all the way out. This is a abduction, bringing the arms all the way out here as far as you can, and up over your head and then down again. And then a deduction, one arm at a time. Bring one arm across your anterior chest. All right, and rest that arm down. And then do the same thing for the other side here, bringing your arm all the way across and then back again. So that's the range of motion that you would check there for each of the parts of the shoulder joint. Now, and then there's two other motions that you want to check of the shoulder joint. One is external and the other is internal rotation. So you can have the patient bring your arms to your side and then all the way out like this. Okay, that's external rotation. And internal, then bring your arms all the way across your chest. Internal rotation. Now you have a little bit more range of motion than that, and you can test that. Bring your arms up like this, let your forearms hang down. This is external rotation, and then internal rotation, and you see you get a little bit beyond what you can with that anterior range of motion. All right, and that's the extent of range of motion of the shoulder that you would be checking. Now you'll go on to check strength. And checking strength of flexion first and extension. Again, you want to compare one side to the other, but I'll stand just behind Nick here. Now I want you to push your arm out against my hand. Okay, that would be extension. Pull your arm in forward. Okay, that's flexion. And then I can compare that also on the other side. So I'll walk over to the other side. Again, press back against my hand and push forward against my hand. So after checking flexion and extension, then you can check abduction and adduction. Abduction, or away from the body, is the chicken wings. Hold your arms out a little bit, and I'm going to press in. All right, and then adduction or adduction is bringing the arms in towards the body. Now bring your arm in towards your body, or press against my hand is one way to describe that. And do the same thing on the other side, press in against my hand. All right, so that's abduction and adduction. Next, I'll check external and internal rotation. And external and internal rotation both check some of the rotator cuff tendons. External rotation checks the infraspinatus and the teres minor tendon. So I'll ask the patient to keep your arms at your side, and then you're going to push out against me with your forearm, first on this side and then on this side. And if there were some problems with the rotator cuff of those tendons, the patient may feel some diffuse pain in the upper shoulder area. Now the next one is internal rotation, which checks the subscapularis. So bring your arms again, the forearms forward. Okay, now press in against my hands here. So pressing in, checking both at the same time, or you can also cross your hands like this and press in against my hands to give you some added strength to check internal rotation. Now, after checking range of motion and strength, the last part of this is to check special maneuvers. These are maneuvers that help you to determine whether there's other pathology in the shoulder. And one of the first tests to check is the empty can test. Can you bring your arms out in front of you? And now rotate your thumbs down, and this is the empty can part of it, and make sure the patient's arms are out just about like this. And now I'm going to press down. You hold your hands just like that. I'll press down. Any pain in the shoulder area with that?
No.
All right, so that's the empty can test. You can rest your arms there. That checks specifically the supraspinatus tendon of the rotator cuff. Another technique is the lift-off technique. The lift-off test checks the subscapularis, just like the check of the internal rotation test as well. Now what you can do is bring your hand, your left arm to the back as though you're going to scratch your back. All right, and palm out is the important piece. Now push against my hand here, and this is a lift-off test, again checking that integrity of the rotator cuff tendon. You can put that arm down and then check the same thing on the other side, push against my hand or lift off the hand from the back. Now the next two tests, check to see whether there's any impingement. The rotator cuff tendons sit and fall underneath the acromion, and they can be pinched if there's some swelling of the tendon or some arthritis underneath the acromion. And so the first test is called the near test, and you can remember this test because you're bringing the arm near to the ear. So what we'll take is your arm like this, and I'm going to be pressing down on the scapula a little bit. This is in order to maximize the amount of pressure that there is against the tendons. And then you rest your arm, and I'm going to bring it all the way up like this, and to find if there's any discomfort, any pain at all with that. Okay, so if there's pain, there could be some impingement of the rotator cuff. Now I would also check that on the other side too for comparison if there was a little bit of discomfort there. The last test is called the Hawkins test. And the Hawkins test, you can remember this because you're making the patient's arm look like the wing of a bird or the hawk. And so you can bring your arm forward like this. So the first thing to do is bring the arm forward, then flex the elbow at 90 degrees, and then pressing down again on the scapula, and then rotating the arm in like this to the point where it stops. And this, again, if there's any discomfort with that, could be a sign that there's impingement of the rotator cuff. And that concludes the advanced testing of the shoulder. Next, I'll perform the elbow exam. And like any exam, starting first with inspection. And what am I looking at here? Mostly, the areas on either side of the olecranon here is, does it look fairly similar here on this side compared to this side to make sure there's no swelling? Looking at the olecranon itself, looking at the antecubital fossas on both sides as well. Then next is palpation. I'll specifically palpate over the olecranon. There's a bursa located there that can become swollen. Palpate on either side of the olecranon here. These are the lateral and medial epicondyles. Here's the lateral epicondyle. This is the medial epicondyle, an area where someone can experience tendinitis, so making sure there's no tenderness in those areas. The joint line itself, the elbow joint, is something that you can feel along either side of the olecranon and here in the front over the anterior to the epicondyles. Then the next area to check is range of motion. So flexion and extension first. Can you bring your arms up all the way, making sure there's equal motion both sides, and then bring your arms all the way down and out. Again, making sure there's equal extension, and you can bring your arm over here. Everybody has a little bit typically of hyperextension, and you can see that here as you rest the patient's elbow on your hand. Then the next range of motion is supination and pronation. Bring your hands out like this. Think of supination as holding onto a cup of soup, and then pronation, bringing the hands so that they're pointing completely down to the ground here is pronation. Then strength testing is mostly flexion and extension. And what I can do here, you can rest this arm down, is that I can isolate and hold the joint here. And I can ask the patient, now bring your hand up against my hand here, or bring your forearm. There you go. So flexion and then push down against my hand is extension here. And then I'll compare the same thing on this side. Pull up against my hand and push down against my hand. All right, so checking both sides. Then after checking that, then there are the special maneuvers, checking for specifically lateral and medial epicondylitis. Lateral epicondylitis is known as tennis elbow, and this is an area where someone would experience pain over this particular group of muscles. And so the way to check this is, okay, can you bring your hand down like this, flex your arm, and when someone brings their wrist up or their hand up, that's going to be using these muscles right here. So push up against my hand. All right, so he's going to be pushing up against my hand using that group of muscles there, and if there's pain, that would be indicative of lateral epicondylitis. And then checking medial epicondylitis, this is the golfer's elbow. Same problem, but on the medial epicondyle. Bring your wrist up like this. Now press down against my hand. Okay, so using those muscles again would cause some pain and discomfort if there was medial epicondylitis. The motion of this too by itself stretches those tendons and muscles and can sometimes cause pain here, or if you bring your hand down like this stretching can also cause some discomfort here. So those are the special tests of the elbow. And that's the end of the elbow exam. The next part of the exam is the wrist and hand exam. Again, making sure to compare one side to the other and starting with inspection. So in general, I'll just look at whether both wrists look similarly. Look at the hands here. This is the thenar eminence for musculature is at about equal on both sides. Now you can turn your hands over here. And when I look at the wrists here and the top of the hands, again, is everything looking similarly, or do I see any joints that are deformed one side compared to the other? Then palpation is next. You can rest this hand here, and I'll demonstrate here on the left hand first. First palpation is the snuff box. Can you bring your thumb out like this? What you'll see here is Nick brings his thumb out is there's a little bit of a depression between two tendons of the thumb. You can relax your thumb now. That's where the snuff box is. This is a very common place to experience a fracture if a patient falls on his outstretched hand. So I will palpate in that area specifically to make sure that's not tender. Next, I'll move to the dorsum of the wrist, or the top of the wrist here. There's several tendons that run over the bony prominences of the wrist, and I'll palpate those tendons, checking for any bogginess or swelling, which could indicate tendinitis. The next place to palpate is the distal radius and ulna. Those are prominent here, just proximal to the wrist here. Ulna and radius to again make sure there's no tenderness. Then moving into the palpation of the joints. This joint here is the carpometacarpal joint of the thumb, a common place for patients to develop arthritis. And I'll move and examine each one of the joints. A good way to examine joints is to flex the digit, stabilize it, and then use my thumbs to palpate, or fingers to palpate along the joint line. You can really feel a sharp distinction of the joint line as you're palpating here and then moving out to various joints. I'll again check that. I'll show you how that is on the metacarpal phalangeal joint here. Again, flexing, I'm stabilizing with this finger here, and I'm palpating along either side of the joint line there, and I can feel the joint itself right beneath my thumbs. And I'll check that on each of these metacarpal phalangeal joint lines here. And then moving out here to the joint line, the joint here of the interphalangeal joints, again stabilizing here with my fingers, and then palpating, almost boxing in the joint to find if there's any swelling. Again, moving out to the other joints. This is a good technique to practice for all these joints because each one of them feels a little bit different, and for you to feel comfortable with what each joint feels like is important, especially if you have a patient who has any type of arthritis. Palpating along these joints can tell you if there are any abnormalities. And thumb. Then I would compare this, of course, to the other side as well, checking snuff box, dorsum of the wrist, the radial and ulna, then moving to the carpal, metacarpal joint here, and up and out along each of the joint lines here. And this is something that you can become quick and proficient at as you palpate each one of these joints. Following the wrist and hand palpation, then the next part is to check range of motion. And so if you can follow what I'm doing, flex your wrists down like this and bring them all the way up like this. And then also bring your wrists out like this and in like this. And that's ulnar and radial deviation, both of those directions. Then can you make a fist grip, okay, both sides to make sure both sides are equal. Then spread your fingers all the way out. This is finger abduction. Then turn your hands over like this. Now we'll check the motions of the thumb. Nick has his thumb in extension, so extension of the thumb, and then flexion is curling the thumb in like this. Then abduction of the thumb is bringing it straight up, and adduction back down. And opposition is bringing it across towards the pinky. And those are all the motions of the thumb, and each one should be tested independently. All right, now you can rest your hands down here. Now the next part of the test is checking for strength. And I'll start by checking wrist flexion and extension. You see how I'm kind of stabilizing the wrist here. Now if you could make a fist, and now push up against my hand. Okay, that's wrist extension, and wrist flexion, push down against my hand. And comparing on the other side, make a fist, press up against my hand, extension, and down is flexion. Now I'll check the strength of ulnar and radial deviation. So again, I'm going to stabilize, make a fist here, push against my hand out this way, and push in against this way. And the purpose of my stabilization of the wrist is so Nick isn't using elbow motion or shoulder motion. It's just allowing him to use just wrist. And then checking on this side, press against my hand this way, and press against my hand that way. I'll check fist grip next, and a good way to do this is for you to cross your fingers as you see I'm doing here. You don't have to do that, Nick, just I will. And the purpose of that is so that Nick can't squeeze my fingers too hard. Now you can make a grip here, and then same thing on this side. Now squeeze as tight as you can, and then what I'm doing is I'm trying to push with the thumbs to see if I can get my fingers out, but it's almost impossible for Nick to hurt my fingers if they're crossed in between his fists like that. All right, the very last part, the very last testing of strength of the hands is thumb abduction. So I'm going to go like this and press against the thumbs to see whether or not the strength is equal on both sides. All right, you can rest your hands. Now the next tests are the special maneuvers to check and determine whether there are any abnormalities of the wrist. A very common problem is carpal tunnel syndrome, where the ulnar nerve is pinched between some of the wrist bones. And a test to check for this is called the Tunnell sign. And so if you can turn your wrists over like this. Now the median nerve runs right here between the wrist bones. What I'm going to do is I'm going to tap. Tunnell is for tapping. I'm going to tap on the median nerve here. If a patient had carpal tunnel syndrome, as I'm tapping here, you'll experience some numbness and tingling in the first 3 fingers here as I'm tapping. And so I can check on the other side too to find out. And this is, you see the speed that I'm tapping, and I can continue to tap until the patient feels symptoms or it's obvious that he's not going to after several taps like this. Now another test to check for carpal tunnel syndrome is called the Phelan, or it's thinking of it as folding the hands. So if you can bring your wrists together like this, the key aspect here is that the wrists are together, the hands are folded down like this. This is pinching the median nerve between the wrist bones again. And this is something that a patient should hold his hands like this for about 1 minute in order to tell whether there's, again, any tingling or numbness in that first, second, or third digit. All right, you can rest your hands. So those are the 2 tests for carpal tunnel syndrome. The last test is checking for a synovitis. There are some tendons with tendon sheaths in this area in which there is some synovium. And this is called de Quervain's tenosynovitis when someone experiences some inflammation in that particular area. The way to check this is to stretch on that tendon. So if you can take your thumb and fold it inside your fist like this. Okay, so Nick has his thumb inside his fist, and then let me do the stretching. And then what I'm going to do, I'm going to stabilize the forearm, and I'm going to pull down and stretch that tendon to determine. And this is called the Finkelstein test, and it's to check for de Quervain's tenosynovitis. Now if you can do the same thing on the other side, thumb in, make a wrist, and then I'll stabilize and stretch against the fist here. All right, that's the last of the special maneuvers for the wrist.